So, hi, my name is Priyanka. I am a first year family medicine resident. I'm a PGY1 and pre-educated helped me pass COMLEX Level 2
Sweet.
on my third attempt.
On third attempt. Gotta have that in there. That is important context.
Yeah.
All right, Pri, well, thank you so much again for coming on today. First off, I got to say, how does it feel to be a winner?
Oh, it feels really great now. Now I'm a doctor now.
Right.
So now I get to be in that position where I get to see patients, and I get to now actually learn about what is actually how to actually be a doctor.
Yeah.
So
is it much different from med school, like studying for boards?
Yes, 100%, 1,000%. I don't think med school remotely prepared me for a residency.
So are you telling me studying for boards is not learning medicine?
No.
It's totally different? Man.
Totally different.
Isn't that
totally
frustrating?
Yeah.
It's just these hoops we have to jump through, unfortunately.
Yeah.
But that's cool. Yeah. So could you give us a little background? Like, what was your story like before you met us?
Yeah, sure. So I struggled with the COMLEX exams a lot. So especially COMLEX Level 1, I struggled with, but I eventually passed on my second attempt. But COMLEX Level 2, for some reason, was giving me a really hard time. The first time I prepped for about 4 months for my first attempt, still couldn't pass it. The second time I tried, again, prepped a really good amount, like 4 to 6 months again, really doing Q banks, and still I couldn't really get passing that COMLEX Level 2. So I was thinking I really needed a tutor, and I really needed someone who really knew the exam very well so I can take it again. And I really needed help. So I looked through online. I really just looked through Reddit. I looked everywhere, and I really saw good reviews of Dr. Mark Lucas. He had really great reviews, because when I was looking for a tutor, there's a lot of USMLE tutors, which is great, but COMLEX exam is a very particularly different exam than USMLE. So I wanted someone who did really well in the exam, and he's a 99th percentile score. So I'm just thinking, okay, so he knew something about how to take this exam. And I was like, I trust this person who's taking this exam, Level 1, Level 2, and Level 3. So I wanted someone like that. Cool. So I trusted him.
Cool.
So
you have a really unconventional story. So you basically studied for a whole year for the first 2 attempts cumulatively.
Yes. And
then when I met you, you were just finishing up 4th year, right?
Yes. Okay. Yeah, I did. And I matched too. Exactly. So without my Level 2 score. So I was like, I really needed to pass this in order to move on to the next stage of my journey. Otherwise, how can I, it was a very big thing for me. Mm-hmm. So I wanted someone who I could trust. And I looked at, Dr. Mark Lucas's credentials, and I looked at I'm like, okay, he knows this exam very well. And he has a good success rate. So I was like, I'm going to trust this person. So that's what I did. Yeah.
Yeah. So we kind of glossed over that, but that's a really important detail that I had never heard of before meeting you. Yes. But you failed COMLEX twice, and then you matched into an FM residency without a score.
Yes.
And graduated med school without a score.
Yes. Yes.
Is there some magic to that? Because I've never heard of that before.
My situation is very rare. I don't necessarily. I recommend people try to take their exam, but I just applied and I told residencies, hey, I don't have my score yet. Yeah. I haven't passed yet, and they were appreciative that I was honest with them, and I think I had a program that really liked me and took a chance on me. And now I'm at that program that I'm currently here today. Yeah. So they kind of knew who I was, and they kind of trusted me. So that does happen. It does happen. I had it also happen to other my classmates as well, where they just didn't have their score yet, and they interviewed and they graduated med school too. So yeah.
Wow. Yeah, no, I've heard of people getting lots of interviews without a score, without passing, but I'd never heard of anybody actually matching and graduating med school. Yeah. So that's really interesting. I wonder, have you heard of other students doing that?
Like, yeah, as I said, I've heard of people like interviewing. I think what happens is a lot of people like assume that they won't get matched. I just assume like, oh, if I don't, and then it is what it is.
Yeah.
But like, I gave it a shot.
Yeah.
And I matched. So
Absolutely.
I was like, okay, I'll go through it.
Yeah.
So that's what I did.
Might as well try, right?
Yeah, I know. That's what I did. I didn't care. I was like, okay, if they, liked me and they believed in me, I said they would wait for me. So, and they did.
Perfect. Yeah, they waited for you and you passed. I think it was September, just a couple months ago, right?
September. Yeah.
Yeah, that's fantastic. And then you got to start and now you're an intern. That's amazing. You know what? I do have to say, you don't look nearly as tired as I would suspect an intern would look.
Yeah, no, I got good sleep.
I want to go to that program. That sounds like a nice program.
Yeah, it is a nice program. It is.
Okay. So can we, let's get a little more background on what you were doing to study for the first couple of attempts. Like what was working, what wasn't working?
I think, so the first attempt, I used TrueLearn and ComQuest. So because that's what people recommended me and that's what my school recommended me. But I didn't get a good score and I was just kind of sad. And then my second attempt, people were like recommended me UWorld, which, it is a great resource, but you have to use it correctly. And I think Dr. Lucas told me how to use questions because I think when I was doing questions, I wasn't doing them properly. And then my third attempt, Dr. Lucas taught me how to incorporate Anki and how to make a good study plan, and he gave me an outline on how to do a reasonable amount of questions where you could actually learn from it and not just do questions like hundreds a day, but actually learn from your questions, make Anki cards, and actually use spaced repetition to learn that. And that really made a difference for me because I think my issue last time was I was forgetting the information, but Dr. Lucas taught me you need to do Anki with your questions and really pair it together and also try to understand. I also incorporated AI into my learning as well this time too, and trying to understand the concept of the question. And so he taught me how to do that as well. Yeah. So
Cool. So basically we gave you a strategy and you went off and implemented it and you did it very well.
Yes, I did.
Do you mind sharing what your first couple of scores were on COMLEX? You can say no.
Yeah, sure. So I scored a 333 on my first attempt, 389 on my second attempt, and then I increased around 70 points on my third attempt, which is now 455. So that was a big increase.
Yeah. And I think that was your last attempt, right?
Yeah.
There was nothing else after that.
No, it was all in. Yeah.
Yeah. Because I know you said they weren't going to let you start. I mean, obviously, we wouldn't have, rescinded your place in the residency or something.
Yeah.
Made it, but we did. Yeah. It was awesome.
Yeah.
And you found us off Reddit, right?
Yeah, I was looking through people. I was trying to find okay, what should I do if I'm in this situation? And people said that if you were someone who didn't do well in COMLEX, they told me about this guy, Dr. Lucas. He's really great. He teaches and tutors well, and he knows COMLEX in and out. And I agree with that assessment actually.
Cool.
And I would. Because a lot of the tutors I've seen online, they were USMLE oriented, which is nice. Yeah. But I'm USMLE and COMLEX are different exams. Absolutely. And people who've taken both exams.
Absolutely. And there's really nobody in the COMLEX prep space except us, unfortunately.
Yeah.
It's funny that you found us off Reddit. Yeah. I will say it's the most trustworthy place on the internet. Apart from maybe 4chan, but Reddit, it's pretty good too. Yeah. And we something similar actually like that happened too. So I guess somebody made another post about us and we got a ton of calls all in one day. It was where did you hear about us? Reddit. I'm like, what? Is this should I be marketing on Reddit?
Yes, market on Reddit.
I wish I could say I had
Let's go Reddit. Yeah. And the COMLEX Reddit, those are the big ones.
I guess I got to get on that. I wish I could say I had sleeper cells making the comments Dr. Lucas is the best, but that it wasn't me. Maybe in the future, but in the past, no.
Yeah.
So, you know what? Something that comes up a lot when I'm talking to potential new students is the cost of the program. Yeah. That can be really scary to a lot of people. What are your thoughts on the cost of the program? And maybe what would you say to someone who's considering that option or aspect?
Honestly, you're already spending a lot of money anyways on medical school, and you're already spending hundreds of dollars on COMLEX exams. And you're already spending much money on UWorld and TrueLearn. So I felt for me that if I'm going to spend money, I might as well do it well And so I don't have to ever, and I might as well score well. It is an investment. We have to think about that. And if I'm going to be spending money, it's like relatively low in comparison to like you spending a year in med school.
Yeah.
Or because med school 1 year is like 50 to 70K.
Yeah.
That's like tutoring for like a board exam, which can determine your career trajectory. Like a little bit, like maybe $1,000 is like, that's nothing in comparison. Right. So you might as well, that's how I think of it. And I rather not risk it if it's going to be in a board exam that really determines my life.
Yeah,
so
absolutely. I think you said that well. And so you since you took basically a year to prep for the first 2 attempts, did you have to take a leave of absence for that?
I think because I finished my rotations, so I didn't have to do that.
Oh, okay.
But I think I tried, my rotations were chill. So I worked with my I would say my dean, my academic dean, what I should do. I should take like a month off. And what she did was like, I can just go on a relatively chill rotation that doesn't require too many hours because I was in 4th year. So that's the flexibility you can do in 4th year. In 3rd year, it's a little bit more difficult to do that. Like you have to take a little bit of a leave, but in 4th year, you could probably do a chill rotation and also study at the same time. Like maybe you could do like an online. I did medical Spanish, for example,
Nice.
during my study time. So I could study for my board exam. So I can also graduate on the same time. But yeah, if you're in 3rd year, it would be a little different.
Okay. Fair enough.
Yeah.
We've had a lot of students that had to take leaves. And wonderful part is they still make the students pay free tuition to some extent. I don't think it's the full thing, but they do make them pay something. So they're still enrolled. So it's just like more time is more cost. And then if you think about it in terms of like your attending salary, like if you take it a whole year extra leave of absence, you're losing like $200,000-300,000 doing something like that.
Yeah.
So
it's
a fraction, literally. I don't know. We should make pre-educated university at this point. The whole 2 years of preclinical. We'll do it in 2 months.
Yes, exactly. Yeah.
All right. So other questions I had for you. What do you feel like was the biggest thing holding you back previously?
Definitely mental health and making sure managing my anxiety. That was kind of hard for me because I think it's also taking an 8-hour long exam. But like I would say like what Dr. Lucas did help me and was doing like the mock exams. And I didn't do that last time. And this time, like I did a lot of more mock exams. So then when I took the actual exam, I felt like I was just taking a practice exam. It wasn't, I didn't feel tired on the day. I didn't feel tired at all. I was like, okay, I feel great. I mean, the exam was like tough, of course, because they worded it very hard in a difficult way, but I didn't feel tired like I did last time. Like last time I was both exhausted, but this time I was going through the mock test, really prepared me for the stamina of the actual exam. And I just felt like I was just doing a practice exam.
Yeah.
So
that's awesome. Yeah. So I remember you telling me that you had a lot of issues with stamina, just basically staying awake. I think you also had some like medical stuff, but we obviously won't get into that. And certainly that was not helping. So what we ended up doing was we had you take a ton of like 4-hour proctored remote tests just because I know I actually remember the first ComSay I had you take. You called me in the morning and said, "Hey, Dr. Lucas," basically it's like, "I'm really nervous. Should we take this?" I was like,
yeah, I know. I was so scared because like, and then mimic, and that's what it was. It was nerves, like when you were taking the exams.
Right.
So he was trying to mimic, like Dr. Lucas was saying, no, you have to, because you need to mimic the nerves that you feel during that exam. So he was just basically like, that's basically a form, like that is a form of therapy, basically. Yeah.
It's exposure therapy.
It's exposure therapy. So yeah.
Also tough love. Yes, you have to take it today. We did an absolute ton of it because I knew right away when we first worked together, like you're very bright. You knew all the answers. You were crushing your practice banks, like 70s, 80% correct. Yeah. And yet you get like a 320 on COMLEX. It just doesn't make any sense.
Yeah.
And I've seen that a ton. People that are doing really well on their practice tests and then falter on the actual thing, especially if that's happened over multiple tests, like MCAT, level 1 and level 2, probably a history of test taking anxiety. And so what has worked very well for many people with testing anxiety is doing that exact strategy that we did for you. Having you take a ton of mock exams away from home, proctored, to make you feel as uncomfortable as possible. And you said when you showed up on test day, it just felt like another day in the office pretty much.
Yeah.
That's awesome.
Like it wasn't scary at all. Like I didn't feel I didn't feel I was as nervous as I was before. I felt like awesome. It was just I was just putting whatever it was in my brain. I was just like, okay, this is whatever I knew. And
that's sweet.
Here you go.
Perfect.
Yeah.
Yeah. We addressed that big issue. And then I remember we had a big talk at the end.
Yeah.
I was trying to get you to take the test for like 2 months, basically. Do you remember how long we worked together? Was it like 4 months?
4 months. Yeah. So we worked together for like 4 months, but like the first month was more like, because I was on rotations that first month.
Yeah. Okay.
So, and then the second, and like, I think it was like the second to fourth month, I was off rotations. I think that's what it was. And so I think my trouble was, I guess, anxiety and fear in taking the exam. And I think with Dr. Lucas, I think I trusted him. He said like, hey, you're ready. We did all the practice tests. We did all the Yankee. You did all the work. You're ready to take it, and trust me on this. And so I was like, I trusted him, and he was right. He was complete. His assessment is very accurate on whether he can really tell whether you're ready to take it. And I actually really like that about this program, because I think that's what I was afraid of. I was like, how do I know if I'm ready to take it or not? But Dr. Lucas can really tell. He can say, he can look at your practice scores. He can look at how you take exams, how do you take tests, how your mental health is, and he can say, okay, you're ready to take this. So
absolutely. So I actually, after you graduated from the program, I ended up putting together a video series on like everything that I normally tell students from start to end. And I have a whole, I think it's 16-minute long video on whether or not you should postpone. And it's got everything you just said, like practice test scores, question bank scores, and a big one is confidence. Yeah.
Confidence.
And I noticed as you were going along, like you actually called me twice for like 2 comp days in the beginning, 2 separate ones.
Yeah, I know.
As you got better, like I didn't get those phone calls anymore. Right.
Yeah.
The more we did.
I didn't know, because my fear went away after and that's what it was. You were exposing me to exposure therapy, and my fear went away after I was getting exposed to all these practice tests. Yeah. So I wasn't as fearful to take the next one. And I was like, I don't feel the need to, call him anymore.
And so you're still crushing your question banks too. So I knew you were ready. You just had to get you there. And then you took the leap of faith, which was really brave of you. That's really scary, I imagine. Like when you're
but I think I trusted you. I really did. I was like, Dr. Lucas has taught so many students. Yeah. He knows when someone is ready. And I was like, and I also told myself, if I delay it even more, that's even harmful for me, because delaying can also hurt you too.
Right.
So I said, I'm going to just take the exam and take it when I'm ready and when my knowledge is fresh. And you can only postpone it for so long. Mm-hmm. So, yeah.
Yeah, burnout.
Yes.
The longer you go. Were you feeling pretty burnt out at the end of those 4 months?
I think a little bit, but I think what I liked about your exam, your schedule, is that you prevent burnout.
Nice.
You make a really good schedule where Perfect. I have time to relax and decompress, but I'm also studying. So I his schedule that he makes is very manageable. So
cool. I wish I could say that was scripted, but I genuinely was interested if you felt burned out, but that's great. Yeah. We do try to avoid burnout, because it's part of my whole origin story. My superhero origin story is just super burnout from studying for boards. So I try to avoid that for people. So now you're a resident, learning real medicine.
Yes.
I got to ask, will you be returning us for level 3?
Yes, 100%. I definitely want to. It's going to be a little more difficult for level 3, because it's you're a residency and you're working 12-hour shifts. Yeah. So man, it's going to be very interesting studying for level 3, but I've heard that there's this, I don't know if this is true, but it's not as bad as level 2 or level 1. So
I think they get easier as you go on.
Yeah. Yeah.
Unless you get super bad.
I'm also an FM, which really helps me a lot, because I think it's way more difficult. If you're in especially T rotation where you haven't used, old ERPs in a long time. So at an advantage also as well, that if I go through a year, a while of FM, like it will help me with my boards too. So that's something I'm also thinking about. And it tests you more on medicine. It's less hopefully less, I've heard that it's less minutia. It's more now medicine oriented.
Yeah.
And usually a lot of people, they're not trying to, I heard a lot of people pass this exam more than level 2 and in comparison to level 2.
Yeah, absolutely. So. It's just, so much more now. You've actually been able to see it, and they just lower the passing score. So it goes from a 400 on level 1 and 2 to a 350.
Yes, that's true. Yeah.
Which is like 3rd percentile.
Yeah.
So not too bad.
Which is way more manageable than like 10th percentile or something. Yeah.
Yeah. Just to wrap up here, if somebody was on the fence about working with pre-educated, what would you tell them?
I would tell them invest into it, because I think the reason I think people have hesitancy is like they're investing a lot of money and they want to make sure that they get a great outcome. And I will say you're going to get a great outcome with pre-med educated. Other tutoring companies won't invest into you as Dr. Lucas will, because he will look at you as a person and he will see what you are struggling with and he can adjust to you. And I think that's what I really like about this, because everyone's different. Why someone else struggles is maybe different from what I struggle with exams. So Dr. Lucas will look at you individually. He will look at your weaknesses and he will adjust according to that. And that is a good investment. That's completely different than taking like a board review course, because a board review course is very uniform and it doesn't match to everyone's weaknesses, strengths, whereas Dr. Lucas is very particular on you and how to going according to your strengths and weaknesses. So I definitely would 100% invest. And yes, it is of course it's going to be pricey, but boards are pricey. Like the board, just even purchasing the board exam is pricey.
Yeah.
Like, would you rather have several attempts and then going through the headache of taking the exam again or not even be able to graduate? So it's worth it to it. I think the more concern people have is, if I am going to pay for it, will it be worth it? And I would say, yes, it is. So
cool. Thank you for that. And I know you keep mentioning, name dropping me specifically. I think towards the end of our tutoring together, we started onboarding more faculty, like more attending physicians. Yes. How did you like working with them too?
Yes, I worked with Dr. Bosler for OMM, and he's so helpful, and he goes over all the OMM techniques, and it's very important because I think people underestimate OMM on COMLEX, but to have a faculty member who actually wrote some of the questions for the COMLEX exam, knows how the COMLEX exam works, especially with OMM, that's super helpful, because there's just not many OMM, OMT, tutors out there. And so to have a faculty member at a DO school that is teaching OMT, reviewing the common weaknesses, that's super helpful.
Cool. Well, Doctor, I thank you again for your time. I think that's about it. I'm sure some people have questions for you. Yeah. Would you mind if they reach out to you on any of your social? I don't know if you got a LinkedIn or anything like that.
Yeah, so I have a Doximity account. They can reach me out, but I can also, if they want to email me too.
Oh, okay, sure.
Yeah, cool. You want me to give you my email? I can send it.
We'll take it afterwards and we'll put it next to this video.
Yeah, sure.
Super helpful. All right, Pri, thank you so much again. Congratulations on being the resident that I never could. And I look forward to seeing you for level 3.
Yeah, thank you so much. Thank you.